Hello, my name is Dr. Joel-Franck. I'm a neurosurgeon. I deal with injuries to the brain and the spine, the spinal cord, and the cervical spine in particular. Now, I'm glad to have finally met you because I understand you've seen 25 or more providers, and no one believed that you're in pain. No one believed that you have severe headaches. No one believed that you have confusion in your daily life. I do, and I'm here to help you because I understand exactly what is the cause of this, and I have come up with a surgical solution that will render you and give you back your life. So I've been involved in the practice of medicine for something like 43 years since I went to medical school at Yale University School of Medicine, and then through a training program, the Upstate Medical Center in New York, in Syracuse, New York. That took 7 years. And as my career developed, and when I went into practice in 1986, first in Maine and then in Florida, I began focusing an interest on the cervical spine, on the neck. I've operated on probably 10,000 patients on brain tumors, brain bleeds, aneurysms, fractured neck, spinal injury, you name it. I've been involved in that. However, my focus and my interest has become more and more on the cervical spine. And the typical operation that is done involves a herniated disc, a slip disc in the neck, pressing on the spinal cord. I've done over 4,500 of those cases with great success. However, I began to see a class of patients that had something entirely different, which is they were involved in a car accident, and it didn't appear at first as if there was any serious injury. There was no fracture, no paralysis, no coma. But over a period of months and years, these patients' lives began to be disrupted and destroyed. Their home life, work with their spouse, enjoyment, raising children, enjoying pets have been taken away. They began experiencing brain fog where they couldn't focus on anything. And they began experiencing severe cervical pain and severe headaches. And I came across a method of diagnosing the spinal injury, that is an injury to the spine itself, not the spinal cord, that is unique. It's a movie. It's a video of how we move our spine in real life, called a digital motion x-ray. Regular x-rays that are taken in a doctor's office or in the emergency room or a hospital are static. The patient is in a fixed position, usually flexion, extension, and a straight-on picture. However, in this technology, the patient is asked to move their neck in normal motion, in stressed motion, in the motions that cause them to have pain. And then we are able to see abnormalities of neck movement due to ligament injury that explain it all.